Thank you. Good morning. So I'm pleased to welcome everyone to Wolverhampton virtually for the West Midlands Health Technologies Cluster Roadshow. And if I share my screen here, which will doubtless take a moment, and hopefully that's showing okay for everybody. Hopefully I'll get a message if it isn't. So I'll kick off with a summary of health technology activity at the University of Wolverhampton. So we've got a big footprint in the region with 4 main teaching campuses at Wolverhampton, Walsall, Telford and Burton, and 23,000 students overall. And for our university, a big emphasis on health technologies across our faculties, research institutes, and regional economic development programs. And we've also got the University of Wolverhampton Science Park, which is home to over 100 businesses. And pictured at the top right there is our new science centre, opened a couple of years ago and designed for health and life science companies in particular, with access to laboratory space and shared facilities, that kind of thing. A new tenant for us this year is a COVID testing laboratory. So we've had some strong growth in that. So in our faculties, the Faculty of Education, Healthcare and Wellbeing, and health technology obviously is it's core to that, with a big presence at Walsall and Burton and growing at Telford as well. So we've got a broad range of degree level courses and have awarded 11,000 nursing qualifications over the last 10 years. And again, in the faculty, just in the last few weeks, work has started on a £5 million investment at our Telford campus to create a new health and social care training centre. So we've had March's LEP growth deal funding support from that, and that centre will provide new simulation facilities that can be used across the health and social care disciplines. Those facilities are going to be particularly relevant to our degree apprenticeships, where we've got healthcare subjects like healthcare practitioner and nursing, and then laboratory scientist and over into the Faculty of Science and Engineering, relevant degree apprenticeships there as well. So in the Faculty of Science and Engineering, as you can see, there's several schools there with strong healthcare connections, and home to much of our related research in areas like nanotechnology, antibacterial delivery, production of cell secretome, porous implants, tissue engineering, additive manufacturing, of biomaterials and digital health. To advance our healthcare research, we've established the Research Institute of Healthcare Sciences, which is led by Professor Tracy Waugh, and it's a multidisciplinary cross-faculty institute with 7 key research areas: oncology, chronic disease, clinical medicine, infectious disease and control, drug design and delivery, public health and epidemiology, and pharmacy and healthcare practice. We've also got a strategic partnership with the Royal Wolverhampton NHS Trust, and where we've got 7 consultants at the trust, also professors at the university, and engaged in collaborations with our university-based researchers and working on translational health research. And then finally, our engagement in regional innovation support through 2 ERDF projects in particular. There's the Science in Industry Research Centre, which supports innovation and collaborative research projects with SME companies in the northern part of the region, Birmingham, Black Country, Shropshire and Staffordshire. And the Smart Concept Fund, which awards proof of concept grants to SME companies that are developing innovative new products. And through the Smart Concept Fund, some really good example of health technology innovations that we've supported. So that's a quick overview of our activities, the breadth of our activities. What I wanted to do was focus on a couple of example projects. So I'd like to hand over now to Dr. Vinod Kanappan to present an example of our work, university research translating into commercialization.